Baby plagiocephaly, prevention and treatment. Plagiocephaly is a cosmetic problem that can affect your child's self-esteem as they develop and influence his childhood and adolescence. Plagiocephaly is the most common craniofacial abnormality. It consists of an asymmetric distortion of the baby's skull. This is found flattened in the posterior, occipital region and has a diamond-like shape. It is a purely cosmetic disorder that does not affect the intellectual development of the baby. Its incidence is high and is mainly due to the posture in which the baby is to sleep. It occurs when, from birth, the infant sleeps on its back, with the head always on the same side. However, it can also be present from birth. In this case, it may be due to a narrowness of the mother's pelvis or even a complication during childbirth. In this article, we, therefore, explain how to prevent and treat plagiocephaly. Why does the plagiocephaly form? Plagiocephaly is caused by pressure exerted on the baby's skull. This can be during fetal development, at the time of childbirth or after birth. The incidence of plagiocephaly has increased significantly as pediatricians now recommend placing babies on their backs to sleep. This position prevents the newborn from suffering from sudden death during sleep. On the other hand, it also exerts continuous pressure on the same area of the skull which eventually deforms. In addition, baby carriers have also been linked to this increased incidence. Here are some other situations that can promote plagiocephaly. Premature birth. Congenital muscular torticollis causes the baby to always rest on the same area of the skull. Improper position in the uterus. Trauma during childbirth. Symptoms of plagiocephaly. As we mentioned earlier, this is an aesthetic pathology. It does not compromise the intellectual development of the baby. The most remarkable thing is that it produces facial and cranial asymmetry. In addition, it also causes misalignment of the ears as well as a bulging forehead. Plagiocephaly can decisively determine a baby's self-esteem in the future. Therefore, it is very important to know some measures to prevent and treat it in time. How to prevent this disorder? Since the baby must sleep on his back, it is important to move the head posture. The ideal is to alternate the supporting side between the right and the left. On the other hand, it is advisable that the child spends some time on the stomach when he is awake. Tummy time is a method that helps develop the motor skills of the baby. It only applies when the baby is awake. This method involves placing the baby on the tummy, as we said earlier. This can be done on the parent's chest, on the bed, or on any comfortable surface. The main thing is that he spends a little time playing, under supervision, in this position. Thus, the muscle capacity of the baby is strengthened. The most important thing is to avoid prolonged support of the head in the same posture. To do this, the baby can be in the arms or a chair that does not press on his head. That is why it is also recommended not to use chairs that maintain a fixed position, such as car seats, for too long. In addition, it is possible to set up other interactive measures. For example, you can place toys on the other side of his bed. This makes your baby more likely to turn his head. Another alternative is to lift the mattress slightly to tilt it. Treatment of plagiocephaly. The treatment can only be used when the above measures have not worked. First of all, it is possible to use tight-fitting helmets. They consist of applying moderate pressure to the skull. In addition, they prevent the head from resting on the deformation. It is a dynamic cranioplasty orthopedic system. These helmets are used from the 3rd month of life. It is essential to carry out regular reviews as well. Surgery is only used in very severe cases. This is because it should only be used if all other procedures have failed. It is essential to follow preventive measures to prevent this from happening. These are simple exercises and measures that will prevent the baby from suffering from a major unsightly problem. Finally, the ideal is to go to the doctor in the face of the slightest doubt or the slightest anomaly. He will be able to advise you and help your baby,